Every Thursday, let's get skin to it with dermatologist Dr. Sandy Skotnicki and personal stylist and beauty enthusiast Marlo Sutton for a new episode of Skin to It, where we guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Skin to It, a podcast brought to you by Bioderma. Welcome to Skin to It, your guide to healthy, beautiful skin. I'm Dr. Sandy Skotnicki, board-certified dermatologist.
And I am Marlo Sutton, personal stylist and beauty enthusiast.
So it's so great to be here again. What's happening? What's new with you?
Lots new. Well, I'm actually going to go with my daughter to my first ever all-women's retreat. So I'm really excited about that. It's going to be yoga and meditation and dance and exercise, but we're also going to have wine and really good food. So
Awesome. I did
very
that.
fun.
I did that a couple times last year. I have to say it. I'd never done it before, and there's something to be said about it. You come back recharged, and
Yes.
it's a good thing to do, and you get to do it with your daughter, and which is
Really
wonderful.
special.
Yeah.
Very excited.
For me, I just came back from my farm. I love hiking, as you know. I went on a nice hike, and it's just so nice to get out of the city.
Yeah.
Yeah.
I know.
Yeah.
That's what's so great about hiking. I mean, we that hike in Peru and hikes you've done abroad are amazing, but you can also do it in your own backyard.
Just getting out of the city and in your own backyard.
Yes.
Absolutely.
Okay. So listen, today's episode is Dermatology Lasers Decoded, your 101 guide. So we're really, really excited. We actually have a guest today, Dr. Lee. She'll come on in a little bit. And as we start off each episode, Sandy is going to give us a definition, a scientific medical definition of lasers and what they do and what does that actually mean.
So we were chatting before, and I was asking you if you knew what laser meant.
Yeah. And I mean, to me, laser, when you say the word laser, I get a very good visual of a beam of light. But what I didn't know was that it's actually an acronym.
It's an acronym. So laser, for all you listeners, means light amplification of light amplification of stimulated emitted radiation. See, I even have to repeat it. So
I'm not going to remember that, but
yeah.
but the light, yes, light amplification.
Well, it's interesting. Like sometimes I'll see people write laser, Lazer. So they obviously don't know what they're talking about. It's not, it's an S. So what is how does it work? Well, it's a fascinating history, and it really dates back to the time of Einstein and another scientist, Max Planck, who really started to look at, can we harness the energy of an atom? So, the atom is the basic unit of life, and there's electrons that move around it. So it's about harnessing that energy. And so it really started with Einstein. And in 1960, the first doctor was American surgeon Leon Goldman, who kind of pioneered lasers and using that energy from light dermatological conditions. And then during my time, I graduated in 1997. So there
So
was
long ago.
Yes, but we don't look that,
So
So
we have used good lasers.
we use good lasers. We have good lasers. Well, really, that was the advent of when lasers in dermatology really started to take off. So
Right.
the physician, his name was Rox Anderson. He's still alive, an MIT, Harvard dermatologist. And he had the great idea of a concept called selective photothermolysis. So you can destroy things with a laser, but there's a lot of damage to the tissue surrounding.
Right.
So selective photothermolysis is like, let's think about if you have a red face and you have the hemoglobin, which is the basic unit inside the blood vessel. It absorbs a certain wavelength. So if you target the light to that wavelength, you can selectively destroy the blood inside the blood vessel and destroy the vessel without damaging the surrounding skin. So that's selective photothermolysis. And that really changed lasers, and they just took off after that. Yeah.
Yeah, I love that. So obviously for me as a consumer, we've talked about this. That's kind of the reason I'm on here with Sandy. I'm going to be the one coming to her office and saying, okay, Sandy, what laser is best for me? What's best for my skin? What is going to get me the best results? And I think that's, some questions that Dr. Lee's going to answer.
Yes. And she does a lot more lasers than I do. I know all the science. I had to pass my exams. I have lasers in my office, and I'm medical director there. So I understand them, but I haven't kept up with all the trends. There's new things and new advances. But essentially, lasers first started off to treat red. So it would selectively target that hemoglobin. I have those sort of port wine stains, like those purple stains on their skin, things like that. Then we got to target pigment or melanin, so for brown. And then there are ablative lasers that destroy the skin, and they are great for wrinkles and
Right.
acne scarring. And so that's just a little bit of an overview, but I know that Dr. Monica Lee, our guest, is going to really get into the weeds on that. And I'm so excited that she's offered to join us.
Okay. Wait.
So we're going to introduce our guest now. Our guest is Dr. Monica Lee, who is a board certified medical and cosmetic dermatologist in Vancouver with a subspecialty interest in skin lasers. She's a graduate of the health sciences program at McMaster University, followed by her medical degree at the University of Toronto, and she then finished her dermatology residency at the University of Calgary.
Dr. Lee then continued further advanced cosmetic dermatology and laser training as part of the prestigious American Society for Dermatologic Surgery accredited fellowship in Virginia, USA. She is a fellow of the Royal College of Physicians and Surgeons of Canada and a diplomat of the American Board of Dermatology.
And just a few fun facts. Dr. Lee has a special interest in ethnic skin, acne rosacea, as well as laser medicine. And she's a passionate supporter of the BC Women's Hospital Foundation, having served in the annual gala committee for the past 3 years and as its co-chair for 2023. And we always talk fashion because she always looks great at all these galas. We have that in common.
So we're going to get a crash course today in lasers for your skin, everything you want to know and more. Please welcome Dr. Monica Lee.
So it's so great to have you with us. We get to hang out a little bit, even though we didn't hang out much at the meeting. But thank you for agreeing to join us today. So we want to start off first, and we're going to call you Monica, if that's okay, Dr. Lee. Um,
Absolutely.
yeah, about your journey to becoming a top laser dermatologist. How did you get here?
And okay, Dr. Skotnicki, can I call you Sandy as well?
Yes, of course, of course.
And
Okay,
it's
that sounds
Marlo.
great. And Marlo, yes, yes, yes. You've been in
Nice
the
to
email
meet
thread,
you.
so nice to meet you. All right, Sandy. So you know what that is, as you know, if you talk to any of us who've been in school for a bajillion years, that's always a loaded question about how I got to where I am. Like yourself, I'm a board certified dermatologist. I'm board certified actually in the US and also in Canada. And to get to doing what I'm doing now, which is a lot of laser work in my practice, took, 4 years of undergrad, 4 years of medical school. Then I did a 5-year residency program in dermatology. And afterwards, I went to the US and did a laser fellowship for a year in Virginia under the programming of the American Society for Dermatologic Surgery, or the ASDS. So, this is a dermatology association that really has an international reach. Many of our colleagues are members within the society, and they've organized a fellowship program where many states have training to facilitate, knowledge uptake and also clinical applications of whether it's, cosmetic injectables or lasers. But I did a specific year focus in lasers. And then I came back and started my practice. And of course, as we all know, medicine is a lifelong journey. There's ongoing learning. I haven't learned everything, even though I feel like I've been in school for a long time, but I still continue to learn every day from my peers, from my patients, as I continue to do my laser work and other medical and cosmetic dermatology work.
I
Wow.
know. That's
Wow.
like I don't think people know how long, dermatologists have to do or any specialty for that matter. Did you do some work with Tina Allister? Was she in Virginia? I thought she was in Washington.
Yeah, so Dr. Tina Ulster, who's dubbed the Queen of Laser,
Yes.
she's actually a mentor of mine,
Yeah.
a pivotal person in my professional career. I actually did not do my fellowship with her, but I do believe that sometimes in life we find people that are just so like-minded, and she's definitely a trailblazer in the world of laser medicine. And during my time when I was doing my fellowship, and I did my fellowship with Dr. David McDaniel in Virginia, I had the opportunity to seek additional elective experiences. And that's when I went and did an American Society for Laser Medicine and Surgery preceptorship with Dr. Ulster. And that's how, we started our, I guess our mentor-mentee relationship. I'm going to actually see her this coming weekend because we're co-chairing a session at the American Academy of Dermatology meeting in San Diego.
That's right. I know I'm not going to that one.
Oh.
Monica. Hi. So, what are some of the most important points you would like to get across to the public about laser dermatology? So, I'm coming at this. I'm the consumer. I'm the person who's going to go to my dermatologist to ask them what type of lasers are going to be right for my skin. So, what's somebody who's new to this and who's looking to have some laser, dermatology done for them? What do you want to really get across to them?
That's also a big
Long,
question.
sorry, yeah, a little.
That's a big question. So, if I put my shoes in a consumer, an individual who's not in the medical field, I think it's really important to, first of all, find someone that truly has expertise and experience in doing what they're doing because many people think that, oh, I can just go to a place that has a special or has package pricing or they can get a Groupon.
Mhm.
But at the end of the day, these treatments are being done on the skin and often it's skin on the face, which if there was any scarring or dyspigmentation or problems, that individual will need to live with those outcomes for possibly a very long time. So I think it's really important to find a physician, and there are other physician clinics as well who might delegate those procedures to staff members that they trust who are still trained appropriately. They would be under direct supervision of the physician, but it is a reputable center or clinic that has that expertise.
Yeah.
So it's really important to, I always say, for a lack of a better term, to not cheap out on these things
Right.
or to, just follow the hype of what, for instance, social media might portray, because you really need to check the credentials of the person who's delivering the treatment or the center that you're seeing. So I think that's definitely an important point.
Yeah.
And, in
Oh, I was just
Just
going to
saying.
say that's why in Toronto, of course, if any of my friends ever ask me, what I'm doing for my skin, and I obviously refer them to Sandy's office. And sometimes they'll tell me, they're like, oh, I'm so happy you told me because I was about to go to this, I bought 10 sessions at my, nail salon or something. They don't go to the right people or they get all this bad advice. And I always say, just go to a dermatologist's office, get the right person. It's too
But
important.
I think just to echo what you're saying is somebody that's registered and a physician. One of the things I always say to my patients, and that's why I wanted to start with this, is what do you really want the public to know about lasers for dermatology? And the first thing is safety, right?
correct.
So one of the things I explain to my patients is I think of lasers, and correct me if I'm wrong. This is a rudimentary. I like analogies. You can get a MacBook computer or you can get an Acer computer. They're both going to do the same thing to a certain extent. They're computers, but one has got so much more advanced technology and you're really paying for that, which, it's in the price. It's the same thing with the laser. So if you go to a spa, they're not going to have a MacBook. And also the person running it may not be a physician because those types of lasers, those really good lasers are not going to be sold unless there's a physician associated with them, running them, and making sure that all the I's are dotted and T's crossed. What do you feel about that?
Yeah, absolutely. Your analogy is bang on. I do think that, well, for sure, safety is first when it comes to any medical treatments, lasers or otherwise. Yes, the more sophisticated platforms or devices that are targeting skin concerns, they tend to either be only sold to physicians, that are completely legitimate, they're properly registered, they've had the training,
Mhm.
or as you pointed out, it's not so much the device because machines are machines. They're inanimate. They can't deliver a treatment themselves. They require the provider or the person who's dealing with the treatment. So how that device is used in different hands will
Sure.
determine safety and outcome. So even if it was safe, patients or the average consumer may not also get results. So it might be a cheaper treatment with the exact same device, but where someone might get excellent outcomes that they're very happy with a few treatments versus someone who do a package and they do 10 treatments, but they see nothing or not much.
Well,
That's the
that's
difference.
technology. That's the technician driven, and I think
Yeah,
you have a question about that.
yeah, I mean, that was really pretty much answered my question, but how, just how important that technician training is. And are the technicians and what about the upkeep of the equipment? And how often is this equipment being updated?
So, I mean, laser technology in itself, it's gone through many, many generations. Because if you think about lasers, they all started for human use in the 1960s. So we've had about 6 decades.
Yeah.
And especially in the first 3 to 4 decades, early days, this is when we really see an explosion of very unique, distinct laser technologies. But nowadays, modern lasers, they're still upgrades, right? First of all, it's just like any car
Right.
or a home. There has to be ongoing maintenance, and that's going to be done by the engineers who visit my clinic, for instance, where I have lasers. They do at least a once a year preventative checkup to make sure things are running and the energy that's being fired and delivered to the skin is uniform, it is consistent. And then, of course, if there's any issues with running a device, and sometimes lasers that tend to be used a lot in offices, then and we're busy, the people that are operating it, just like a car, you drive it a lot, you're probably more likely to need to take it to a shop for an oil change.
Right.
So similar, a laser that's used a lot because that clinic or that physician has a lot of experience, treats a lot of patients. There are many patients who are happy. There's word of mouth. It subsequently means the laser is being used more, and then subsequently that means that there might be increased chances of it breaking down and needing repair. But beyond the technical, aspect or the specifications, if you're talking about a non-physician, like a laser technician or an esthetician or a nurse who is being delegated to do these procedures, there are a certain number of treatments that they need to perform, usually on like a family friend or a colleague in the clinic before they can be what we call like in the industry like signed off so that they can actually deliver that treatment on a real consumer, on a real patient. And then also even then there is ongoing refreshers that not only the physician but the any of the staff who's doing these treatments in a clinic, they have to undergo on a yearly basis just so that they can keep up with new protocols, new approaches when treating patients.
So we're gonna like change gears a little bit because I glad that we spent a lot of time on safety and like the
Going to the
actual
right place
going to
too.
the mechanics.
Yeah.
Is the car analogy is great. I mean, you can have somebody who has a 12-year-old machine. Sometimes places will get secondhand machines, and this isn't something that the consumer is always going to know about. So my when I talk, like I have lasers in my clinic, I don't do them. I've never really geeked out on lasers. Like, I have my other interests like allergy, but I know the rudimentary workings and obviously I know how to explain what's what. But the way I want to know how you explain it, what I tell my patients, just like I break down skincare, it's like I don't talk about brands. I talk about, okay, retinol can be used for X, Y, and Z, right? So I say skin tightening lasers do this. There we have lasers for color, whether you have red or brown. We have lasers that are ablative for wrinkles and acne scarring. How do you break down the categories when somebody's coming to your office and they're like, I don't know what I need. Do I need, And so what do you say?
Yeah, I mean, similar. I think it's really important that the public understands lasers, not in the nerdy way that we as dermatologists love and thrive on, but essentially kind of what I tell my patients essentially the same descriptions that you just mentioned. So if I see something for instance, if I take a scar, a patient might have a scar from surgery, they might have acne scars. And if the scars has texture and has color, then I explain to them that certain lasers might target color, and the color is typically broken down into red or brown. If we have textural issues where it's dipped into the skin or there's a dent or there is some contour irregularities, we have lasers that help to stimulate collagen so that we can help fill that indentation in and smooth and improve the texture of the skin afterwards. There are, of course, lasers that can also nowadays, in the recent several years, target acne. I don't have that laser,
Okay.
but I mean, you have to think about, as I tell my patients to think about the fact that when we have lasers, we are ultimately having this energy target a specific thing. And that specific thing is also very specific for the platform that I'm using.
We actually I did a little bit on, selective photothermolysis and
Oh,
Roxy Anderson before you came on, but and sort of explained how that really revolutionized laser use
yes.
for medicine.
So can I ask a question again
Yeah.
as the
Consumer.
as the consumer and the person who's so is BBL a laser?
Mm.
Is
So so
Fraxel a
so
laser?
again, rather than getting caught up in, like, names, I talk about BBL is a trade name, but it's IPL. So IPL technically is not laser, right, Dr. Lee?
Correct. Yeah, like IPL is intense pulse light.
Okay.
And if the by pure definition of what a laser has to deliver a certain number in that wavelength that's uniform throughout the entire treatment. So there's one number. So if there's a pulse dye laser, for instance, is either a 585 or 595 nanometer laser. Whereas if you talk about IPL or intense pulse light, it's a spectrum of light ranging anywhere from the 250s to the 1200 nanometer, but there's not a specific number that is linked with an intense pulse light, whatever brand it might be, and hence it is by definition not a laser.
No laser. But the
Okay.
great thing about the IPL, and you can agree with me or not, Dr. Lee, is that because it does different wavelengths,
Mhm.
it gets both red and brown. So it's a great thing to start when you just have lots of red and brown to sort of clean that up. And it's not as sometimes not as painful. I don't know.
So are you using lasers for existing sun damage?
Hmm.
Absolutely.
Yeah.
Yeah, there are different types of lasers that can affect and also positively treat sun damage. So when you talk about sun damage, that's a big category where it can translate to either, pigmented lesions. So people might have liver spots. They might have dull skin tone. They may also get some early fine lines because of loss of collagen. So if you're talking about sun damage, then you're talking about different lasers that would target those specific outcomes because of sun damage. But for instance, a popular type of laser that's great for sun damage would be in the non ablative fractionated category. So, this is where there's these little tiny holes that's uniformly put into the skin. And there's some skip area, so then you're not heating up the skin in the area that you're treating all of it at once. But these little holes are injury spots that then trigger and stimulate the body to produce new collagen and elastin. And then if there's brown spots because of the sun, this process also causes some of the brown to kind of meander to the skin surface and then it flakes off. So the
So
skin afterwards becomes a bit brighter. If there's a bit of fine lines, it helps to soften them. And overall, some of the effects of premature signs of aging due to
uh-huh.
sun damage, they're effectively targeted.
And are there people that you don't recommend lasers to? Are there people that just, respond to it, certain skin types or skin tones that respond better to lasers?
So I think anybody could be candidates for laser treatments. Ultimately, it's choosing the right device,
Mhm.
using the right settings. That's most important. And that it goes back to our initial start of this podcast where we need to have as a consumer make sure that the person that's doing the treatment or you're trusting your face to is properly trained, has the experience. So there's not really anybody who can't do lasers. Now, in my own office, I don't necessarily treat people who are under 18. Now, I
Okay.
have pediatric patients who might have a birthmark. And in that case, the birthmark is, on the corner of their eyes, on their cheek, and it's, really impacting their self-esteem. Then I would treat because it's not only purely about wrinkles or skin tone. We're talking about this issue that really affects that person's mental health. So in any case, when I think in patients who are skin of color, So we're seeing this change in our demographics across Canada and really in North America and many major metropolitan cities. We have a very multicultural neighborhood. So because of that, we need to just be more careful when choosing lasers. There are certain parameters that we might deliver the laser treatment so that it's more safe.
Mhm.
But ultimately, anybody could be a candidate, but it depends on what the issue is that we're treating, and then also the training and the expertise and experience of the person who is delivering that treatment.
I have a question for you, and I agree with you about making sure that, especially patients of color, I find lasers can be a bit more tricky. That the light lasers, like the V beams or the IPLs that are focusing on color, because there's heat, right? But the fractionated laser, which is like, we have a whole episode on microneedling, but
Yeah.
fractionated lasering is like microneedling on steroids, just more holes and deeper. That's how I kind of explain it to patients. But I have a question about age because I had a client just a few weeks ago. She was in her mid-20s and she came to me because we didn't really talk about skin tightening lasers. So they're actually not lasers, they're ultrasound devices. That's one I have.
Mhm.
And they heat up the muscle to tighten. And she was 26. So she had this therapy done in Los Angeles and she wanted to have another one. And I was like, you don't need it. What is your sort of thought on skin tightening lasers and age cutoff?
Yeah. So, I mean, skin tightening. So, first of all, lasers that really make an impact to substantially improve skin tightening right now in the current market, it's not, it doesn't exist.
Mhm.
So, if you're talking about lasers that actually can effectively skin tighten the way, for instance, surgery could, it just does not exist. And even energy-based devices. So we're not talking about that single beam now or that beam with a certain number, but we're just delivering a lot of heat into the tissue. And the heat initially causes a bit of swelling. And so when you have a bit of swelling, things plump up and things look tighter because there's swelling underneath. It's still not that effective and the outcomes are not sustainable. So people can do a series of treatments and then for a month or two afterwards, yes, things look more plump, things look more taut. But after that, if they don't continue to do these treatments on a regular basis, then the skin tightening effect is lost.
But do
In terms of,
you think there's an age cutoff there? Like, I mean, doing
yeah.
this tightening, I mean, I know that they're not going to give you a facelift, but doing a skin tightening treatment on a 26-year-old?
I think we really need to, as the consumer, use discretion. I mean, we know that right now there's a lot of hype and trends that are driven by social media, and that's probably beyond the scope of what we're talking about today.
Mhm.
So it's hard to combat that, right? But as a dermatologist, I would say, and as a physician first, I would say that I don't have a solid age cutoff. I don't treat anybody cosmetically under 18. But
Yeah.
I do agree with you that skin tightening for someone who is in their mid 20s, even like mid 30s, is likely not necessary. Now, I can think of certain situations where maybe someone they underwent cancer treatment and they lost a lot of weight. And because of that, they have a lot of loose skin because they went down by 50 pounds. And, they're cured, they are in remission, they're better from their cancer. But now that they're medically better, they're healthier, they're dealing with a lot of loose skin, and that impacts their self-esteem. So I can't say it's never, as you know, in medicine, it's never black or white, and
Silver
it's never
bullet.
an absolute. So, but in general, if someone is just because, I see this on a TikTok and I want to make sure I'm preventative, there are some other preventative treatments that's still good for skin texture and skin health. But if someone doesn't have frank skin, like, very obvious skin tightening, and they're going and doing and spending thousands of dollars to tighten their skin when they're that young, I don't think that is,
No,
that's necessary.
you're
And
you're
it's
being very
where does it
political.
end?
You know me, I don't, I have that reputation. I don't beat around the bush. I don't think it's necessary, and I don't think that people should be selling skin tightening things to women in their 26 with no issues.
Right. And that's what I would say about so great going to Sandy is that, you know, I think she really is going to recommend a specific laser or treatment to somebody because she feels that they really need it. We're not just doing it to do it.
Mhm.
It's,
Well,
you've
I
got
mean,
something specific you want to
yeah,
treat, and it
yeah,
could be fine lines. I
yeah.
mean, that's
Yeah,
That
and pores. I mean, we can be really have pores that you don't like and have a fractionated laser for that. Listen, we have to wrap it up because we've had such a great conversation, but we could talk on and on about lasers. I wanted to just end with, is there anything else you want to add? Anything that we didn't cover that you really want to talk about, or any trends that you see coming
any new lasers that are coming out?
for women in their 50s? No.
Like I said earlier, the laser world is always fascinating and exciting because there's lots of engineers and physicists in the background before we even see all the magic and the jazz, in clinics that are working on developing laser technologies. There's what's coming. Sometimes it never makes it to the market, right? There are things that are being worked on at Harvard, for instance. But for instance, we do have some newer lasers that can target acne, but sometimes
Okay.
cost can be prohibitive. There's also lasers that can help. It's called the cold laser, where it helps to rejuvenate the skin in terms of targeting wrinkles and stimulating collagen. That supposedly is much safer in skin of color patients or anybody across any skin tones. And that's also something new that's available in the US, but not yet in Canada. So I think sometimes when we see some trends or new technologies in the US, it does make its way to Canada a couple of years later. But I do think the world of laser is very exciting. It's based on science, and it should always be based on science first. Hence why it's important to make sure you see someone who is scientifically trained, like board certified dermatologist, so that
Exactly.
you have a safe and effective treatment.
Well, listen, we want to thank you very much for joining us. I'm sorry about the
Thank you.
technical issues. You are you're our first guest that we recorded. You won't come out first, but you're the first one that we recorded.
Yeah.
Yeah. So
Couple of
it's
growing
a couple of
pains,
growing
but we're
pains.
getting
Yeah.
there.
Thank you very much. Appreciate your time, and we'll let you know when this comes out. And you were great. Thanks so much.
Thank you.
No, thank you. I'm excited to see the outcome at the end of it.
Okay.
Thanks, ladies. Have a good weekend.
Bye bye.
Thanks. You too.
Thank you. Bye.
Thank you so much for joining us on this great episode. I hope you learned a lot about lasers, safety, what treats what. Do get
Yeah.
a good overview there.
Yeah, I thought that was amazing. She's very knowledgeable, and I learned a ton. And yeah, I think it's the future, right?
All right. Well, thank you very much for joining us, and we will see you next time on Skin to It podcast.
Thank you.
Bye.
Bye.
Catch us every Thursday for a fresh exclusive dose of Skin to It. And don't forget to subscribe so you never miss out on the skincare wisdom. We will guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Loving our podcast? Share your thoughts and help us grow by leaving a review on Spotify and Apple Podcasts. Until we meet again, see you soon on Skin to It, your guide to healthy skin. Skin to It, a podcast brought to you by Bioderma.